DNR is here. I saw some folks with DNR shirts. Good for you for taking on the Healthy Works, our guide to healthy eating, and changing the way you're ordering stuff, our Energize Your Meetings, and using it throughout the agency. We've been talking about that for a long time, and Kyle, we put that together, about 2-3 years ago at the Department of Health, because we hold a lot of meetings with people. We bring people into those hotels up there on the SeaTac Strip or here, and instead of having something with a lot of sugar, which I know we like, and those are okay choices now and then, but to have things like making sure that you've got choices like you've got fruit and some carbohydrates to start your morning to get your engines going, but using it also for just what you're going to eat. That kind of energize your meetings. And we have some late-breaking news. Higher Ed Board here. Hi there. Hi. Higher Ed Board has just received the Work Well Gold designation from the Thurston County Chamber of Commerce. Now, let me tie that together. Our Steps to a Healthier U.S. project. This was a Health and Human Services funded project. We were able to get money out to about 5 different communities in the state. And the idea in each of those communities was to get stuff going that improved physical activity and nutrition in their communities. It's a 5-year project. And in September, I visited a lot of communities who were having celebrations because the 5-year federal money was going away. I was at the Thurston County celebration. Here's the Chamber of Commerce talking about how what they did was come up with this idea of, and I want to make sure I call it well, the Work Well initiative. So they would go into businesses, do an evaluation, say, here's what you can do to help improve the health of people in your business. We're talking about businesses here in Thurston County. So to have them come in to the Higher Ed Board and say, here's what we're doing for our employees, and for you to get a gold medal, that's a congratulations I think we all should give. All the projects are absolutely wonderful and examples of how we can do things differently in agency business. Scott said, Mary knows government well. I clock in this month 34 years working in mostly local, 25 years at the local level, and now 10 at the state level. And there are things that are great creative ideas, and it's usually you can count on me to say, I think we better run that one by the ethics board, or oh, that one's a little over the edge, or we don't want to be the headline on that particular one, or whatever the case is. And it's not about squashing the creativity. It's about understanding our authorizing environment. And our authorizing environment has limits, but has a whole bunch of flexibility. And one of the things we did at the Department of Health is make it possible for folks to say, you can take part in a biomonitoring screening that we did on our time. Get yourself signed up. We brought in flu shots. Do it on our time. We want you to be healthy. But no, we're not going to give you our time to go to Gold's Gym and do your exercises. That's on your time. We checked out with all of our risk management and we said, sure, we can make the agency facilities available to you, employee, if you want to have Pilates, and you can do Pilates, or you want to do some dance exercises. But even things like games. There's a game night. There are a number of people who are in wheelchairs in our agency. That's the activity they participate in. Wellness is also about your mind, not just about your body. So it's about how people can participate. They can come in, they potluck on Tuesday night, and when I'm leaving, it's usually after 7 o'clock, and I can remember, it must be Tuesday, I smell dinner. They're in there with their board games. So it's a variety of things and activities that we can help folks with. A couple things I just wanted to mention that I want you to pay attention to this week. Let's go red week. Okay, women, make sure you check out what's going on with your heart. Pay attention. Use this as an opportunity, you wellness coordinators, to get the word out, to get people to do their health risk assessments. And I'll tell you a very personal story about the health risk assessment that has to do with a woman and her heart in my agency. So we kind of pushed about the health risk assessments. And we pushed about the biomonitoring. And I mean pushed. We encouraged, sent notes out. We want you to participate. This is for you. It's also confidential. I know that's a big deal. Nobody else is going to get this information from you. We're going to get aggregate data so we understand overall about our employees. noise just like we do in public health every day about the population. I had to make it very real for our own staff. That this was about our health assessment of our staff, so we would know what to encourage. Whether it was music in the stairwell for people to walk, or whether it really was you haven't participated in your preventive screenings, they're paid for, go get them, whatever the case is. So one of these women, a skinny little thing, and I'm not, but she is a skinny little thing, wrote me a personal note and said, I thought I was pretty healthy. Usually I don't have a problem. I filled out the health risk assessment, and it suggested that I get some tests done. And then I participated in the biomonitoring, and I learned my cholesterol was a little high, and my blood pressure was a little high. And that kind of scared me. So I made an appointment with my doctor. And in fact, the test there confirmed what I heard in the screening. I'm now taking some medication, and I've kind of changed my diet. You know, this is about this woman's heart. Now, women and their hearts sometimes get disconnected. Usually they're giving their heart away to their family. They're usually giving their hearts away to their family. Women's heart disease kills more women because they don't pay attention to the symptoms. So Go Red is not just about a pretty pin or a red shirt or a red outfit tomorrow. It's really about reminding all of us to pay attention to our health and to walk the talk. So I want to thank you for your passion, for being willing, on top of everything else, to take on this initiative and this effort, because without you, certainly Steve and I could not do this. And inside my agency, thank you for my team that I see here that keeps things going and are very excited about it, and sometimes have to dampen them down a little bit and say, okay, we'll get there with all of the pieces of it. So it's always about balance in terms of what's going on. And this really is about public health, Scott. As I was thinking about this, it's about how aggressive we can be in the planning that we do for something because we've learned about our own employees. So Mary told me stories about how they've learned they have so many smokers. But you know, it's tough for people to quit smoking. And it's a matter of how am I going to get the message across? And you can't be disappointed when the change doesn't happen overnight, but being aggressive about the fact that that's the issue you want to tackle, and then laying out a plan and being patient because it takes individual behavior change to finally at some point do that assessment and say, and now we have less smokers. That's kind of what public health is about. It's about hurry up and wait. I've learned the information or the data. I know what the smart interventions are, but darn it, people aren't adapting them quickly enough. That's the patient part. And then the waiting part is to say, now, let me take a look backwards and see if I've made a change. We can't accomplish everything in this 2-year pilot. Actually, it's probably more like 18 months that we really have it going. But we really have begun to change cultures, and that's really what makes a difference. So thanks for all the work you do, and I know you've got work ahead of you today. Got a lot of great people coming in to kind of rev you up. Nice to see returning folks. We worked together on tobacco 10, 8, 9 years ago. And so have a great day. But I'll be happy to answer any questions.